Full clinical examination. The first thing is to do a 360-degree donkey assessment and its environment. The animal welfare should also be considered, like providing water before start of the treatment process. This is done either in a logical order, starting from the nose and finishing at the tail, or working through each body system one at a time. With practice, a systemic approach can be developed. The approach described below starts from the head to tail. Head. Observe the head for any abnormalities or asymmetries, including lesions or wounds or any ectoparasites. Check the eyes. Are they present? Test for blindness. Check and note for any continuous discharge. Check the ears for any other abnormal condition. This can be done by observing or carefully handling the ears without irritating the animal. Open the mouth and check the teeth, which is used to roughly determine the age of the donkey. Observe the color of the mucous membranes to know what the color indicates. Like bright pink is normal, while pale white, yellow, red or purple or bluish are abnormal colors. Capillary refill time (CRT) measures the degree of peripheral perfusion, thus indicating the strength of blood flow to the extremities. Press firmly on the gum until it goes pale under the finger, then release and count how many seconds pass before normal color returns to the area. Normal capillary refill time is 1 to 2 seconds. Capillary refill time is prolonged with decreased peripheral perfusion, e.g. shock. Perform the capillary refill time and normal should be less than 2 seconds. Pulse. Feel the pulse from the mandibular artery. Note strength, rate and regularity of the pulse. Nostrils discharge. Check for the color and smell of the nasal discharge. The color can range from clear to blood-tinged or yellow-green. Submandibular lymph nodes. Palpate between the rami of the mandibles and in the region of Weber's triangle to determine whether the lymph nodes are swollen. Thorax. Heart. Listen to the heart using a stethoscope placed on the body wall of the animal in line with the point of the elbow, usually on the left side, but it's also advisable to listen to the right side for mamas too for at least 1 minute using a stethoscope. Feel the strength of the heartbeat, the rhythm, and record the number of beats per minute. Lungs. Auscultate both sides of the animal inside the triangle to listen to the lung sounds in at least 4 places each side. Listen for both the rate and effort. Lung sounds should be clear and the animal should not show any signs of increased effort. Remember to listen for abnormalities in the tracheal and laryngeal areas too in case of upper respiratory tract disease. Abdomen. Auscultate the abdomen inside the triangle to listen to the gut sounds. It's important to be able to know whether the gut sounds are normal, increased or decreased. Urogenital and reproductive system. Examine for evidence of swelling, discharge or injury. Do not forget to look at the mammary glands in the females, especially if nursing mares. Musculoskeletal system. Examine both the forelimbs and hind limbs for any swelling or abnormality. Assess the hoof walls for signs of cracking and wear, which may indicate poor hoof quality or poor hoof management. Look over the soles of the feet to check for any foreign bodies, bruising or smell. Rectal temperature taking. Procedure of taking the rectal temperature. 1. Shake or flick the thermometer until the mercury falls down to the bulb. With a digital thermometer, this isn't necessary. 2. Lubricate the bulb with Vaseline, jelly or water. Lift the tail in a welfare-friendly manner. 3. Slide the bulb gently into and along the side of the rectum, avoiding insertion into feces, which results in an inaccurate reading. 4. Wait at least 60 seconds or until the beeping sound with a digital thermometer. 5. Remove the thermometer gently and keep it horizontal whilst reading the temperature.